A woman named Doris called my office at 8 in the morning, and she sounded exhausted before she'd even said hello properly. She told me she'd woken up at exactly 3:07 that morning, wide awake, heart pounding slightly, mind suddenly racing about her daughter's upcoming surgery, her property taxes, a conversation she'd had with her sister 4 years ago that still bothered her for reasons she couldn't explain. She lay there for almost 2 hours before finally drifting off again, only to feel completely wrecked by the time her alarm went off. She said, "Doctor, this happens almost every single night now. Am I losing my mind?" I told her no, she wasn't losing her mind at all, and what I explained to her that morning is exactly what I want to walk you through today, because I think an enormous number of you watching this right now know precisely the feeling she was describing. My name is Dr. Anderson Coco. I've spent nearly 20 years working with seniors here in Virginia, and if there's one complaint I hear almost as often as physical pain itself, it's this specific, strange, frustrating pattern. Falling asleep just fine, sometimes even easily, only to wake abruptly somewhere between 2 and 4 in the morning, wide awake, mind suddenly active, and unable to fall back asleep for what feels like an eternity. Today, I want to walk you through exactly what's happening in your body during those hours, why it becomes so much more common after 60 specifically, and what you can genuinely do about it. Because I promise you, this pattern is far more explainable and far more fixable than it feels like at 3 in the morning when you're staring at the ceiling. Let's start with something I think will genuinely surprise you, because it certainly surprised Doris. There's actually a name in sleep medicine for this specific pattern, waking in the middle of the night and struggling to return to sleep. It's called middle insomnia, or sometimes maintenance insomnia, distinct from difficulty falling asleep in the first place, which we call onset insomnia. And here's the important part. Middle insomnia becomes measurably more common as we age, not because something is fundamentally wrong with you, but because of genuine, well-documented physiological changes to how your body regulates sleep after 60. Let me walk you through what's actually happening, because understanding the mechanism takes away a tremendous amount of the anxiety that builds around this pattern. And that anxiety itself, I want to say clearly right now, often becomes part of the problem. Your sleep is organized into cycles, each lasting roughly 90 minutes, moving through different stages: light sleep, deep sleep, and REM sleep, the stage most associated with dreaming. As we age, the architecture of these cycles genuinely shifts. Older adults spend less time in deep, slow-wave sleep, the most physically restorative stage, and more time in lighter stages of sleep, which are inherently easier to wake from. This isn't a flaw or a failure on your part. It's a well-documented, universal pattern of aging sleep architecture, observed consistently in sleep laboratory studies across populations worldwide. On top of that structural shift, your body's production of melatonin, the hormone that helps regulate your sleep-wake cycle, naturally declines with age. Your circadian rhythm, essentially your internal 24-hour body clock, also tends to shift earlier as we get older, which is part of why many of my patients notice they're naturally sleepier earlier in the evening and tend to wake earlier in the morning than they did decades ago. When you combine an earlier internal clock with lighter, more fragmented sleep architecture, waking somewhere in the middle of the night, precisely when your sleep is naturally at its lightest, becomes genuinely more likely, not a sign that something has gone wrong with your body, but a predictable consequence of how sleep itself changes with age. Now, understanding that mechanism is important, but I don't think it's the whole story, and it certainly wasn't the whole story for Doris, because here's the piece I really want you to focus on today. Waking up is actually normal. Nearly everyone, at every age, briefly stirs between sleep cycles multiple times throughout the night, often without any memory of it at all the next morning. The real problem most of my patients describe isn't the waking itself. It's what happens in the minutes and hours immediately afterward, the inability to simply drift back to sleep the way they used to. Let me walk you through the specific factors I evaluate with every patient who describes this pattern to me. Because in my experience, it's rarely just one single cause. It's usually a combination working together. The first factor I always ask about is what I call cognitive arousal, essentially your mind switching on the moment you wake. Even briefly, this is precisely what happened to Doris. The moment she woke at 3:07, her brain didn't simply hover in that drowsy, half-asleep state the way it might have decades earlier. It jumped almost immediately into active thinking, worry, planning, replaying old conversations. Here's why this matters so much physiologically. The moment your mind engages in active thought, particularly anything even mildly stressful, your body begins releasing cortisol, a stress hormone that is, by its very biological design, meant to promote alertness rather than sleep. Once that cortisol response kicks in, even at a relatively low level, falling back asleep becomes genuinely more difficult, not because of willpower, but because your body is now chemically primed toward wakefulness rather than rest. The second factor is what's happening with your blood sugar overnight, and I've discussed this pattern in a previous video, specifically about blood sugar regulation, but it deserves attention here too because of how directly it connects to nighttime waking. If blood sugar drops too low during the night, which can happen even in people who aren't diabetic, particularly if dinner was eaten early or was relatively light on protein, your body responds by releasing stress hormones, including cortisol and adrenaline, to help raise blood sugar back to a stable level. This hormonal response can genuinely be enough to pull you out of sleep, and it often happens to line up right around that 2 to 4 in the morning window, since that's typically the longest stretch since your last meal. The third factor, and one I ask about specifically in nearly every evaluation, is your evening alcohol consumption, even in what feels like a modest amount. I want to walk you through the actual mechanism here because I think it's genuinely misunderstood by most people. Alcohol does have a sedative effect initially, which is exactly why so many people feel it helps them fall asleep faster. But as your body metabolizes that alcohol over the following hours, it produces a rebound effect on your nervous system, essentially a swing toward increased alertness as the sedative effect wears off. And this rebound tends to occur right in that middle of the night window for most people. Beyond that, alcohol specifically disrupts REM sleep and can worsen mild sleep apnea if it's present, both of which independently increase the likelihood of waking partway through the night. The fourth factor involves your bladder, though I want to be careful here because I've made a full separate video about nighttime urination specifically, and I don't want to conflate the two topics entirely, but it's worth mentioning that even a single bathroom trip in the middle of the night can be enough to fully wake your nervous system, particularly if you turn on a bright light or fully sit up, making the return to sleep considerably harder than the brief, drowsy stirring that might otherwise have gone unnoticed. The fifth factor is one I think about constantly with my senior patients specifically, and that's undiagnosed or undertreated sleep apnea. This is a condition where breathing repeatedly pauses briefly throughout the night, often without the person having any memory of it happening, though a bed partner frequently notices the snoring and gasping pattern. Each of these brief pauses triggers a mini arousal in the brain, sometimes brief enough that you don't fully wake, but often enough, particularly as the condition progresses, to genuinely pull you out of sleep entirely. Sleep apnea becomes significantly more common after 60, and it's frequently underdiagnosed, particularly in women who often present with less classic symptoms than the loud snoring most people associate with the condition. Now, I want to come back to Doris specifically, because walking through her actual evaluation illustrates how these factors often overlap in ways that aren't obvious at first glance. When I asked her about her evenings, she mentioned she typically had a modest glass of wine with dinner, ate relatively early, around 5:30, and often found her mind racing the moment she woke, regardless of what specifically triggered that particular wake-up. She didn't snore loudly, according to her late husband's old comments, but she did mention feeling unusually tired most mornings, despite technically getting 7 or 8 hours in bed. We worked through several changes together, not all at once, because I never like overwhelming a patient with a dozen simultaneous changes, since it becomes nearly impossible to know what's actually helping. First, we addressed her evening whine, not eliminating it entirely, but moving it earlier in the evening, well before dinner rather than with it, giving her body more time to fully metabolize it before bed. Second, given how early she was eating dinner, we added a small, protein-containing snack about an hour before bed, something like a few almonds or a small serving of Greek yogurt, specifically to help stabilize her overnight blood sugar through that longer stretch until morning. Third, and this is the piece I want to spend real time on because I genuinely believe it made the biggest difference for her, we worked on what to do in the moment she woke, rather than only focusing on prevention. Here's what I taught her, and it's exactly what I want to walk you through now, because I think this specific piece of guidance is what most people are genuinely missing. When you wake in the middle of the night, the single most important thing you can do is resist the urge to immediately check the time. I know this sounds small, almost too simple to matter, but I want you to understand why it genuinely does. The moment you look at a clock and see it's 2:47, your brain immediately begins calculating, doing math, worrying about how many hours of sleep remain before your alarm. That calculation itself is a form of cognitive arousal, exactly the kind of active thinking that makes falling back asleep measurably harder. I generally recommend either turning your clock away from view entirely, or if you use a phone as your alarm, keeping it face down and genuinely resisting the pull to check it. Second, and this connects directly to that cognitive arousal issue I described earlier, if your mind does start actively engaging with thoughts, worries, planning, replaying conversations, I don't recommend trying to forcefully push those thoughts away, because in my experience, that effort itself becomes a form of mental activity that keeps you awake. Instead, I teach my patients a technique sometimes called cognitive shuffling, deliberately thinking about something completely neutral and mildly boring, unrelated to your actual life or concerns. Picture, in detail, walking slowly through a grocery store you know well, noticing the specific items on each shelf, one aisle at a time, with no particular goal or narrative. The idea isn't to entertain yourself, it's specifically to occupy your mind with something low stakes and repetitive enough that it doesn't trigger the alertness response that genuine worry or problem solving does. Third, if 15 to 20 minutes pass and you're still clearly wide awake, rather than lying there increasingly frustrated, which itself becomes its own obstacle to falling back asleep, I generally recommend actually getting up. Go to another room, keep the lighting dim and warm rather than bright, and do something quiet and unstimulating, reading something genuinely boring, not a thrilling novel. Avoiding screens if at all possible because of how blue light specifically suppresses melatonin production. Return to bed only once you're feeling genuinely drowsy again. This might sound counterintuitive, getting out of bed in order to sleep better, but the underlying principle, something sleep specialists refer to as stimulus control, is about protecting the mental association between your bed and actual sleep, rather than your bed becoming associated with the frustrating experience of lying awake. Now let me walk you through what I recommend earlier in the day and evening, because prevention genuinely matters just as much as what you do in the moment of waking. Morning light exposure is something I bring up constantly with my patients, and I think it's genuinely underappreciated. Getting outside, or at minimum, sitting near a bright window within the first hour of waking helps anchor your circadian rhythm, essentially reinforcing to your internal body clock what time of day it actually is. This single habit has more research support behind it for improving overall sleep quality than most people realize, and it costs absolutely nothing beyond stepping outside with your morning coffee for 10 minutes. Physical activity during the day, which I've discussed extensively in previous videos regarding walking specifically, also genuinely supports deeper, more consolidated sleep at night. I generally recommend avoiding vigorous exercise within a couple of hours of bedtime specifically, since that can be mildly stimulating for some people, but activity earlier in your day meaningfully supports better sleep architecture overall. Caffeine timing matters more than most of my patients initially realize. Caffeine has a genuinely long half-life, meaning a cup of coffee at 2 in the afternoon can still have measurable amounts circulating in your system well into the evening for many people, particularly as caffeine metabolism can slow somewhat with age. I generally recommend cutting off caffeine by early afternoon at the latest, if middle-of-the-night waking is a consistent pattern for you. Your bedroom environment itself deserves real attention too. Keep the room genuinely cool. Somewhere around 65 to 68 degrees tends to be ideal for most people, since your body's core temperature naturally needs to drop slightly to initiate and maintain sleep. Keep the room as dark as possible, and if street lights or early morning sunlight are an issue, blackout curtains are a genuinely worthwhile investment. Now, I want to address something important, because I never want to leave you with only lifestyle advice if there might be something more significant happening. If your middle-of-the-night waking is consistently accompanied by loud snoring, gasping, or choking sensations that a bed partner has noticed, or if you wake with a headache or notice you feel excessively sleepy during the day despite technically getting adequate hours in bed, I genuinely recommend bringing this up with your doctor and specifically asking about a sleep study to evaluate for sleep apnea. This is a genuinely treatable condition, and addressing it directly often resolves nighttime waking far more effectively than any of the behavioral strategies we've discussed today. Similarly, if this pattern of waking is accompanied by persistent, pervasive worry that extends well beyond the middle of the night, affecting your mood and functioning throughout your entire day, that combination is worth discussing openly with your doctor as well, since it may reflect something requiring more direct support than sleep hygiene alone can address. Let me tell you what ultimately happened with Doris, because I think it illustrates that this genuinely is a solvable pattern, even if it doesn't disappear overnight, so to speak. Within about 3 weeks of adjusting her evening wine timing, adding that small protein snack, and practicing the cognitive shuffling technique specifically, she told me her waking pattern hadn't disappeared entirely. She still occasionally woke around 3, but the difference was in what happened next. Instead of lying there for 2 hours with her mind racing, she was falling back asleep within 20 to 30 minutes most nights. She told me, almost laughing about it, that she'd gotten remarkably good at picturing that grocery store in detail, and that somewhere around the dairy aisle, she'd typically drift back off without even noticing the transition. If you're finding this video helpful, please take a moment to hit that subscribe button, because every single week I bring you exactly this kind of thorough, honest guidance, grounded in real clinical experience with patients exactly like you, not generic advice pulled from nowhere. And I genuinely love to hear from you in the comments. Tell me, does this pattern sound familiar, waking somewhere between 2 and 4 and struggling to fall back asleep? I read every single comment, and honestly, these shared experiences from this community often shape exactly what I choose to cover next. Let me leave you with one final thought before we wrap up today. Waking in the middle of the night, particularly after 60, is remarkably common, far more common than most people realize, because so few of us actually talk about it openly. It's not a sign of failing health, and it's certainly not something you simply have to accept as an unavoidable part of aging that can never improve. Understanding why it happens, the genuine, well-documented shifts in sleep architecture that come with age, combined with a handful of specific practical strategies for both prevention and for what to do in that actual moment of waking, can make a genuinely meaningful difference, the way it did for Doris. So here's my challenge for you this week. Tonight, before bed, turn your clock or your phone face down, out of view. If you wake in the night, resist checking the time, and if your mind starts racing, try that grocery store technique I described, picturing something detailed, neutral, and mildly boring rather than trying to force yourself back to sleep through sheer will. Give it a genuine week and pay attention to what shifts. If you want more of this kind of clear, practical guidance made specifically for people navigating exactly what you're navigating right now, make sure you're subscribed, and I'll see you in the next video, where we're going to talk about something else that quietly affects how well you age, something almost nobody thinks to ask their doctor about directly. Take care of yourselves, and I'll see you soon.